Okay, Miss Santos, we're going to be getting you into your room now. Okay. Can I get a charge nurse in here to assist me?
Hey, what's up? How can I help?
Hey, Jordan, I just need help transferring Miss Santos to her bed.
Hi, Miss Santos. I'm Jordan. Jordan Arlen here. I'm gonna get you to bed, okay?
No hablo inglés.
Okay. Allow the comma.
Yeah.
Comma. Okay.
How you feeling? No hablo inglés.
She's so cute, isn't she?
She's adorable.
With her Spanish-speaking language.
Okay, we're going to move you over from this bed to that bed. We're going to get you comfortable, okay? And then we'll go from there.
Habla, señora?
Just going to take this off.
Everything's locked. Excuse me. I'll grab the slide board.
Okay.
Excuse me.
Okay, so what I'm going to have you do is I'm going to grab all the sheets and I'm going to have you lean towards me, okay? So you're going to kind of move when I gather the bed,
Señora.
okay?
Brazo. Tá bom.
Okay. All right, so I'm just going to have you roll slowly, okay?
Okay.
Okay, now roll back.
Make sure your legs on. Okay. Yeah. Okay, ready? On three. 1, 2, 3. You okay?
Yeah, be okay.
Espera un minute.
Gonna roll, put this way.
Alright, good.
Okay, so if you need anything, just let us know, okay?
You okay?
I don't know, Jordan, I'll be alright.
You will hurt yourself.
Yeah, I really think I hurt my back really bad this time. I don't know how many more times I can do that.
Yeah, it's gonna
Those
happen a lot.
slide boards.
It's been happening a lot. I'll see what I can do. Do some research.
Yeah.
Talk to my boss.
I know I'm not the only one that's been hurting their back, and there's got to be another option.
Yeah, I'll figure it out.
Come in.
Miss Bryant, do you have a second to speak?
Sure, shut the door.
Alright, so,
You should.
yeah, I'm close to you. So, there's a few issues concerning me about, the health of, patients and, more accurately, my staff.
Okay, that's
Um,
good. We are a hospital.
So, we have been having complaints of injuries, back-related injuries with the use of stretchers.
Who are these complaints coming from?
My staff in general. Today, one happened also, and I was there in the room with her when it happened, and I had to send her home because she hurt herself.
Okay.
There's an injury report already documented. Everything's in system. I'm starting to think that maybe we should start possibly be gearing towards hover mats. I've been doing some research, and I think it would be really good for our hospital to start adapting this concept.
Okay, hover mats. What are hover mats? What's the difference? Why aren't the slide boards
Okay,
working?
well, I did actually did some research. So hover mat is actually it's the #1 choice right now in hospitals that a lot of Massachusetts hospitals are using right now. I know we are a Massachusetts hospital, and I know that they're trying to gear towards the use of hover mats. But to make it like really short, basically you can put patients up to, I believe it is 1,200 pounds a patient you can put on a hover mat.
Yeah, but come on. Do we have any 1,200-pound patients in here?
No, you can't, but you also got to think, we do see some 400 or 500 pounds, and that alone could be very troublesome for a woman or a man. The hover mat actually has an advantage. It has these little pinhole cushions inside of the hover mat. So what happens is it inflates, and once it inflates, it actually drastically reduces the weight of the patient that you're transferring from one end to the next.
Okay. Still, I don't know why. Is our staff properly trained on the use of a slide board?
They actually, yes, they have been trained. Yeah, it reduces the weight by 90%. So that alone helps out us with our backs, because we only have one back. But not only does there benefits for us as the workers, but there's a lot of benefits for the patients.
Okay, I'm listening.
So the hover mat actually reduces skin shear and bruising. So those patients who may have a low platelet count, or even those with pressure ulcers, they're gonna need this more than a slide board.
Okay. I mean, I talk about it all the time. We're way over budget as it is.
I know.
How do you expect to pay for these? First of all, how much is one of these hover mats?
Well, I was looking into it, and it seems like it could be a little pricey. They're $2,500 per hover mat.
How are we gonna pay for that?
Well, I was thinking about that also. It's. I mean, I don't know if it's really my say, but we are like, right now the census is really low. These past 3 months, it's been extremely low. We are very overstaffed right now. I was doing some figures in my head, and if we cut hours of maybe two workers, full-time workers, we could be saving about $800 a week, and just that alone, in a couple of weeks, we can get some.
How many are we gonna need? I mean, are we gonna need 1, 2?
Well, most hospitals right now, again, depending on the size and how big the unit is, they have at least two to three per floor, per unit. And studies have shown that there's been a big decrease in injuries, both patient-related and worker-related. So again, I mean, just to like brush up again, so if we're moving a 210-pound person, that person on a hover mat will feel like they're 21 pounds. And it goes right from point A to point B. And it's not just the unit. These patients who are going down for x-rays, MRIs, etc., it's going to make it so much easier to get them from that bed to that stretcher, from that stretcher to that bed. And then just alone on our unit, there's been already this year, there's been about 5 nurses that have thrown their back out, and there's been about 3 of them that haven't really said anything about it. They're working with a hurt back as we speak. What does that say about our future? You know, if we get hover mats implemented into this system, there'll be a lot less work-related injuries, as well as patient injuries.
Well, you've shown me some pretty substantial evidence. I'll definitely look into it. I can't promise, but I'll see what we have for the budget and see if I can manipulate some things to maybe get one of these hover mats, give it a try, and we'll go from there.
All right, thank you.
All right.
Appreciate it.